Good morning. My name is Joan Williams. I'm one of the foot and ankle surgeons here in the Department of Orthopedics at UCLA. In today's webinar, we're going to talk a little bit about ankle arthritis. This is a fairly broad topic, so if I don't touch on some of the specific questions you may have, feel free to ask us on Twitter using the hashtag UCLAMDChat or comment on the Facebook video, and we'll try to get to those at the end. So ankle arthritis, like I said, is a pretty broad topic, and we're going to kind of talk about why you get it, what your treatment options are, and what some of the outcomes of those various treatment options can be, because they're all a little bit different. So the first thing to kind of understand is that ankle arthritis is not the same as the arthritis you get in your hip and your knee. The ankle is a pretty small joint, and considering you put all of your weight through it, it does sustain more weight-bearing force per surface area than the hip and the knee. But even despite that, we actually see far less ankle arthritis than we do see arthritis in the hip and the knee. And there's a few different reasons for that. But the other thing to understand is that if you do develop ankle arthritis, because you're on your feet all day, it can cause some significant pain and really limit your function. And that's usually when you try to find a doctor to get some treatment options going. So the other difference between ankle arthritis and arthritis at the hip and the knee is that the causes are a little different. So I'm sure many people know people who've had their hips or their knees replaced because they just have general osteoarthritis. In the ankle, usually the reason people get arthritis is because of prior trauma. And this can be fractures that had to be operated on. It can be someone who's had multiple ankle sprains in the past, or someone who just has kind of loose and unstable ankles and may have kind of injured them throughout the course of their life. The other reason we typically see it is from inflammatory type arthritises, like rheumatoid or other sorts of inflammatory diseases or infection. And kind of towards the bottom of the causes of this is that general osteoarthritis. So the treatment is a little different because of that, because with traumas and other things, you can get deformity at the ankle that you don't always see with arthritis at the hip and the knee. So the first line of treatment is always to try to manage the symptoms without kind of surgery or anything too invasive. So you can do things like medications, which typically are anti-inflammatories, such as Advil, Aleve, sometimes Tylenol, and sometimes, if those aren't cutting it, people will go into kind of the narcotic or opiate medicines. The other options are to get braces that can help support and stabilize the ankle to minimize the pain with motion when you're walking. You can get shoes that have a little bit of a rocker in them to help transition that weight as you're walking. And there's injections, and the injections kind of vary. You know, you can do steroid injections. There are kind of viscosupplementation type injections, and then there's PRP and stem cell injections, which are a little bit newer and don't quite have the literature backing them up that some of the other injections do just yet. So all of those are things you can try to limit the pain and help you continue with your activities without having to do anything too invasive. If those start to fail, then there are a few surgical options, and these options vary depending on what stage of arthritis you have and how much the pain is limiting you. These can be things such as an arthroscopic debridement. It can involve osteotomies, which means cutting parts of the bones. There's fusion, and there's ankle replacement. So we'll kind of briefly go through all of those. The first one is arthroscopic debridement. And this is a little bit controversial in terms of what studies have shown how much it actually helps with the arthritis. When we go in there with the arthroscope, what we're really doing is clean up any scar tissue, any inflammatory tissue, maybe some cartilage injuries. If you have loose bodies or other things floating around the joint, we can take those out as well. And sometimes with arthritis, you develop bone spurs on the parts of the ankle that kind of cause impingement and limit your motion. So what we've found is that for people who have kind of really early arthritis, mild pain, maybe some stiffness because of scar tissue or those bone spurs, arthroscopic debridement is helpful. If you are kind of pretty far advanced in terms of your arthritis and have really diffuse pain all around the ankle, it's a little bit less helpful. And again, the outcomes with this are kind of temporary. It slows the progression of the arthritis and may limit some of your symptoms for a time period, but you still may require further treatments down the line if your arthritis progresses and gets worse. Osteotomies are probably the least common treatment for this because it's only something that we do if there's a deformity in the ankle. So sometimes, as you can kind of see in this picture, the ankle's tilted a little bit and only one side of the ankle is hitting bone on bone. And if that's the case, sometimes we can cut the tibia, which is the bone on the top part, and realign it so that ankle shifts so that there's space between the cartilage and the cartilage surfaces again. So like I said, this is pretty rare. It's usually someone who's had a bad fracture of their tibia in the past and developed this sort of deformity, or maybe multiple ankle sprains and their ankle, one side is stronger or weaker than the other and it kind of shifts. The outcomes with this, it's great in younger patients who have significant deformity, although pretty much over time, most of those people all do develop worsening arthritis and end up needing some sort of surgery, depending on how young they are when they have that osteotomy. There's complications with this, like all surgeries, and things like infection or the bone not healing can cause other problems or delays in your treatment. So now getting into ankle fusion, and this is typically has been one of the gold standard ways of treating kind of end stage ankle arthritis. So when you're getting to that point where it's always bone on bone, pain with every step, this is one of the options that has been the most popular in the past. What we do in this is we take off the cartilage that remains on both surfaces of the ankle joint and use plates and screws or screws to kind of fuse those two bones together. So as you can imagine, it does cause a significant loss of motion at that ankle joint. But what it has always done in the past is it heals reliably well, and it's very effective at relieving the pain. So the other thing it does is it's a very strong construct. So people who have high demand activities, such as, heavy laborers, people who have to be on their feet with doing a lot of stuff throughout the time, this works better for them than an ankle replacement because it's a little bit more solid, a little bit more sturdy. The problems with it are things like there's always a chance that those bones don't fuse. It happens about 10% of the time, but if it does, that can continue to be painful. You can always get infection anytime you have surgery. And then when you take away that ankle joint, the joints around the ankle have to do a little bit more work. So what they've found is that over time, people start to get arthritis and overuse in those joints around the ankle. And if those become problematic and painful, the only real options for treating those surrounding joints are to fuse those as well, and that can lead to a pretty stiff foot. As you can expect, it also changes your gait a little bit. What they've found when they look at people who have arthritis and people who had fusions and people who had ankle replacements and they studied their gait is that no matter what, your gait with a fusion or an ankle replacement is better than it was when you had just arthritis. But you have more asymmetry between your legs, as you would expect if you have a fusion, because you're just losing that motion in the ankle joint. It can also cause a little bit of difficulty when you're trying to go down slopes or downstairs or on uneven ground because you just don't have that motion to kind of accommodate for it. And then the final kind of treatment option, and the one that's getting a little bit more of a resurgence now, is ankle replacement or ankle arthroplasty. So back in the 70s and 80s, they were kind of experimenting with how do we do this and can we do an ankle replacement. And this picture on the left is kind of the first thing they tried, and basically they just took a total hip replacement and put it in upside down. And as you can expect, that didn't really work out so well. So those early ankle replacements failed, they were horrible, and so that's kind of why everyone got rid of them and kept working on fusions for a long time. As we've learned more about the biomechanics of the ankle joint and we've developed newer implants that work a lot better than that, this has started to become a more common procedure over the last probably 10 to 15 years. And the outcomes with it have gotten a little bit better. So in an ankle replacement, we basically remove the cartilage pieces by cutting a little bit of the bone, and we put metal pieces on either side of the joint and a kind of polyethylene or plastic piece in the middle. So it helps retain that motion, although it's still a little bit less than kind of a normal ankle motion. This, what we found, is a good option for people who have kind of lower demand activities. They like to walk or hike or swim. Nothing that is a lot of impact on the ankle, which is going to cause the implant to wear out faster. So people who want to be running or skydiving or doing something with a lot of impact, we tend to recommend maybe they don't go for the ankle replacement. If you already have arthritis or fusions in the joints around the ankle, we try to do an ankle replacement just to maintain some of the motion in that part of your foot. And as you can expect, if you keep that motion, there's a little bit lower risk of developing arthritis in those other joints. So this is one of the common prostheses that's in use now, but kind of similar thing where you can see the dark spots in the bone are the metal parts that were put in, and there's plastic in between them. The problem with these ankle replacements is that because they've only been in use for the last kind of 10, 15 years, and they're always changing those implants, we just don't have great data on how long they're going to last. What it's really looked like is, on average, most of the implants, 80% of them are doing well at about 10 years after surgery. So that means if you're fairly young, you may have a high likelihood of needing either a revision of both of the metal pieces if they don't incorporate into the bone, or just the plastic piece can wear out over time. The other thing is sometimes you get cysts in the bone, which is a little bit of defect around those metal pieces, and those can be painful. And again, things like infection are always there. So you have more of a symmetrical gait with an ankle arthroplasty than you do with a fusion. But again, it's still a little bit different because it alters your mechanics from what your normal was. So I know that was a really brief overview, but in general, ankle arthritis is a little bit less common than the stuff you see at the hip and the knee. But when it does happen, it can be pretty painful and significantly limit your function because you're on your feet and you need them to do things. So there are many different options, and like I said, it kind of varies depending on what stage of arthritis you're at. But hopefully, if you do end up with any painful arthritis, there will be something that will work for you. And I think we have some questions here. Okay, so the first question is, can surgery be avoided? Absolutely. You know, a lot of people develop ankle arthritis that bothers them sometimes or only with higher activities like running or, jumping, something that's a little bit heavier impact on the ankle. And so those patients a lot of times can do well just by avoiding doing those activities too much, using a brace, or even with kind of ibuprofen and Aleve before and after the activities. So yes, you never have to have surgery. It just depends on how much it's interfering with your life and how much pain it's causing. So the second question kind of goes along with that. It's how do I know when surgery is absolutely necessary? For me, I think this is kind of a personal decision. You know how much the pain is impacting your life and your ability to do the things you want to do. And so if you get to the point where it is significantly limiting you in terms of even being able to go to the grocery store or just kind of get around the house, that's usually when patients opt for surgery and when they're happy with the outcomes. And I think that's it. So thank you all for joining us. And if there's any questions, feel free to give us a call.